Hi there, do you want to understand what is chronic pain, what is lower back pain, what is causing those problems, what is neck pain, knee problems? Everything in this video you understand how the body works. Let's get started. Hi there, I'm Nick Senkov and today we're going to talk about symptoms and signals. It will be the easiest way to understand how the body works and what is chronic pain and how to fix it. The symptoms, you know them. Pain, disc herniation, nerve problems, all that things are symptoms. The medical system and you are fighting those. And you don't have to. That's the last step. The last thing it happened to you, the disc herniation and the pain. But something caused them, right? It didn't come from the sky. The disc herniation didn't go out on its own. Something has to do it, and those are the signals. Before we start with the signals, I want to tell you that we will talk about a lot of signals for you, for the knee pain, for the lower back pain, for the back and neck pain, the most common things and most common signals and problems. I want you to remember something. There isn't a person with symptoms, for example with pain, without body signal. The first thing is the signal. You can have signals for a lot of years before the symptoms are coming. This is the chronic pain. Just imagine a rubber, you use it 2, 3, 4 times, nothing is changed, but after a year the rubber is that small and it's overused. This is the chronic injury. You need time. In some cases the rubber, the person itself, it's really strong and it needs more time before the problem is here. Some people, some rubbers are softer and the problem is coming faster, but that doesn't mean it won't come. This is why we need to look at those signals. The less signals we have, the less problems in the long term we will have, and of course we need to fight them. For example, the knees. The knee itself is a simple joint. It can move only up and down. That means it cannot be a problem. But what you are doing, shots in your joint, some bite, some movement, some rehab, massages, magnets, heat or cold, doesn't matter. But why? The knee don't have anything to do with the problem itself. What can be the problem in moving just up and down? The problem is down below at your feet or up in your glutes. If you have flat feet, collapsed arch or weak ankles, that means you don't have stability, you're shaking. That movement is going up to the knee and the knee is twisting in and out, in and out. Most commonly, the people are with knees buckling in. Those are the signals. If you have flat feet, you hit the knee, and when you're hitting the knee, nothing will be changed because the main cause, the feet, is still there. The problem is still there, and of course, sooner or later, the pain will come back. But if you work out the feet itself to be more stable, have control over the movements of the feet, you will get a little more healthier. Same with the glutes. If you don't have enough glute strength, know it or not, just check that video above me after watching this video to see if you have enough glute strength. So if the glutes are weak, it's the same thing. The glutes and the feet are synergies. They are working together when they are pushing the knees out. And if they are engaged, if they have tonus in the muscle, you're fine, you're good to go. How is the easiest way to check the signal? Just put the feet straight and watch yourself in the mirror where your knees pointing at. If they are pointing outside like those, you don't have a problem. If they are pointing straight or in, you have a lot of signals you need to work on. The next thing, the lower back. Of course, same thing, massages, therapy in the lower back, some relief exercises for the lower back, shots. Here comes the final one, the surgery. How can that change the problem? Again, absolutely the same like the knee. The lower back itself isn't a problem. That's a tiny muscle for stabilization of the core of the body. What can there be a problem? The problem is either up or down. For example, if you have Big quads, if you're quad dominant, that means you lean forward and the pressure will be on your spine and on your lower back. Same thing, the glutes will be weak and the abs will be weak. So you need to work on those, not to hit the lower back again. Anterior pelvic tilt, posterior pelvic tilt, those are signals as well. Shrugged shoulders and kyphosis are again a signal for lower back pain. Why? Because the gravity is pulling us with more weight. That means that little muscles on the lower back, the QL muscle, need to stabilize more weight. And of course they get tired, overworked, the spine is on pressure 24/7, and here comes the problem. So that's what about the signals. If you have those, you need to work on them, on the signals. When you get better on the signals, on your posture even, yes, I know the posture is in the gray zone. That doesn't mean it's not helping. That means nobody is understanding it. Just take a bottle and hold it with straight arm. You will feel how heavier it is to hold it straight and not too close to your body. When it's close, it's nothing. You can hold it for hours. But when it's straight, a few minutes and you're done. That's the idea of the posture. If you're straight, less weight on the muscle and less weight on the spine. Overall, you'll feel better. All that signals, for example, the neck, if you go forward with forward neck position, is the same. 1 centimeter with forward head means double the weight of your head. It's about 10 kg, so 4 centimeters meaning 40 kgs on the muscles and on the spine. And you're thinking and wondering why you have neck pain. Come on. This is the main thing. Remember, if you have symptoms, you have signals and you need to work on those. The first cause of the problem. If you have critical thinking, that means you understand why the medical system isn't working properly and everybody are hitting just where the symptoms. And that's the last thing you need to look for. Same with the shoulders. If you have shoulder impingement or some scapular problems, that means lack of mobility or lack of body control in that area. If you can control the scapula to move it up and down, if you have enough shoulder mobility, 180 degrees, that means you're fine. How many people have it? Really, really small. Less than 1%. And yes, there isn't 99% with people with pain. But as I said, the signal is there for a couple of years or many years before the pain comes. But if you find it, if you fix it before something is happening, you can be sure that you will be fine to the rest of your life. I was Nick Senko. If you have questions, I'm waiting you down below in the comments. Till next time.